Welcome to Pamba Resolute 2020. Pamba is an organization that is for and by private Ayurvedic doctors, and as General Secretary, it is my duty to ensure that such activities are promoted, the benefit of members and the Ayurveda community as a whole. As the name suggests, we are determined to overcome all hurdles and sharpen our minds. Pamba Resolute 2020 is a program developed by Pamba aimed for the Ayurvedic community. We are here to bring a source of continuous learning to the field of Ayurveda. We believe in positive learning with a positive attitude. For an experienced doctor, this is a place where he can refresh his memories. For a fresher, this is a place where he reinvents himself. And for us all, this is a place where we relive the glorious days when the pursuit of knowledge was in our hearts. Let me now call upon our president, Dr. Krishnadas P, for his words. Sir.
Thank you, Dr. Shamohan. Can you hear me?
Yes, sir.
Thank you. Thank you. Dear doctors, Pamba is always with you for your support and guidance. We are duty bound to cultivate a positive culture and steady growth among our members. It is our vision that Ayurveda becomes a global medicinal discipline. Let us prepare ourselves for that inevitable future. Thank you. Thank you all.
Thank you, sir. Thank you. Let me now call upon our treasurer, Dr. P.K. Suresh. Sir.
Thank you, Dr. Shyam. Good evening, dear friends and doctors. The motive behind these classes is to build confidence and the right attitude in clinical practice. I'm sure that the beginners as well as the experienced doctors will cherish this always. Thank you. Thank you very much, and heartily welcome our today's guest, Dr. Srijit. Thank you.
Thank you, sir. Thank you. So it is important for us to bring these classes at the lowest of the cost to the participants, and sponsors are our way of doing things. We thank Vaidyaratnam PS Warriors Ayurvedeshala Kottakkal for helping us with that mission. Thank you, Ayurvedeshala Kottakkal. So just a reminder, all the videos that we have are available on our website. It is www.pambaayur.org. In fact, today is 132nd Resolute class, so all the previous videos are available on our website for those who are interested, who want to learn more. We have daily classes on various subjects, so if you are interested to know more, please do check it out. All you have to do is go there, sign up, and log in. Then on your accounts page there are videos available. So just two other programs that we are having, you can contact, you can go to our website again to find the details about those. Also, we have opened up the Sanskrit and allied subjects, Indian subjects like Jyotisha, Vastu, etc. on two classes that is happening early in the morning, 6:30. Sanskrit is happening on Fridays, and allied subjects are on Tuesdays. So if you want to join, it is free for all. Anyone, all the Ayurvedic community are welcome. So please do join us if you are interested. Again, so let me give you basic etiquettes of this class before we start. All questions are to be posted in the chat, and we shall go through them once the class is over. For best stability, use a laptop and a high-speed net connection. If your video is on, please make sure you're in front of a professional background. In case of any disruption, kindly check your network connection and wait patiently for the class to resume. You may raise your hand if you have a question to ask after the presentation. Make sure you have your full name displayed so it is professional. So with that, let us come to today's speaker. So before starting, let me give you a brief introduction of Dr. Srijit. Dr. S.P. Srijit completed BAMS from Government Ayurveda Medical College, Trivandrum, post-graduation from the same college in basic principles. Since 2008, medical director of the Athreya.com, Athreya Ayurvedic Center since 2010. Since last 10 years, made awareness lectures with videos, experience sharing, training, to more than 5,000 doctors as of March 31st, 2020 on parasurgicals and lesser number of Kuti Praveshika Rasayana. Areas of propagation are Anushastra, Varma, Kuti Praveshika Rasayana, KPR, 2014 onwards. Oncology. Since August 2017, training 765 interns, post-internship from 19 Ayurveda College through 3 WhatsApp groups, and sharing of special clinical experience to famous doctors on a weekly basis with 14 district official group of government medical officers, reaching out to nearly 1,200 government doctors through WhatsApp group. Unit 101 Nucleus team. Regular connect with Indian military personnel for Ayurveda in Indian military, currently on leave for oncology documentation from the post of medical officer in Government of Kerala, Kottayam district. So without any further ado, let me call upon the speaker of today, Dr. Srijit. Hello, Dr. Srijit.
Just trying to unmute.
Yeah, you are.
Am I audible? I
yes,
hope
you are.
so.
Yes, you are.
So I think I should get the video on. Is that the way, or
yeah,
should
that
I
is
take
the
the
way.
screen
That
first?
is the way. You can start your video and
Yeah,
start.
I'm looking at that. Yes, thank you. The video is fine, I suppose.
Yes, it is. It is. It is. Please. Thank you.
And yeah, I think it shows I cannot start screen share while the other participant is sharing. So I'm
Yeah,
not supposed to
please
hold.
try again because
Okay.
I just stopped. No. So you
Okay.
can start again. Thank you.
Let us see. We already made the rehearsal, so I think it should be fine. And there should not be any hiccup on that. Yeah. Does it come now, Dr. Rahul?
Yes, yes, it is. It is available.
Yeah. So I imagine it's now visible to everyone. Dr. Sham, with your permission, I can start.
Yeah, you may. Please.
Okay, so it's all clear.
Yeah, yeah, it is. It
Right.
is. Thank you.
Okay. Namaste to all of you. We will forge ahead with every slide just to make it easy for you. That every slide would have a direct meaning, obviously. It would have an implied meaning and it may have a hidden meaning. So it's all different ways you would say it. So starting from every line of it, the most important word here would be OPD level. And why I choose that word is that it is very important that we have what is called a kind of self-reliance, which is very important. Making a big institution is not easy to start with for a beginner. And single-handedly is mentioned here for the simple idea that we need to make the expenses for the patients the least possible expenses. And at the same time, we need to save our revenue because saving revenue is generating revenue. So when you have less number of people supporting you as a support team, of course, your expenses are limited. And when it comes to the heading called experience sharing, all that I have been doing is only from 2010. And even if I had graduated like 2001, 2002 segment, why the 8 years were not being utilized for parasurgicals? That's what I would be coming to later. So that's why this experience sharing here is of the last 10 years only. And I just mentioned that theatre.com, our family property, we had the privilege of serving or healing whatever we could do the best for. I don't use the word patient because it's kind of a heavy word. We use the word health seeker. We have had health seekers from 104 nations, and why that is mentioned here, that many a times when the so-called conventional methods of the prevailing methods of Ayurveda did not help me, it was this parasurgicals in majority of cases, and sometimes Kuti Pravishkarasayana, that helped me a lot. That is precisely why I have used that narration. And the mentioning of on leave for government of Kerala, I was like, yeah, I am still a medical officer on leave. It's just to narrate to you that the data we get in the government sector is quite huge. It's a huge data. And that makes us very confident about the prognosis aspects and the long-term feedback. So this is because we're posted in one place for at least 3 years, sometimes 4. So it's kind of normally okay to have a follow-up for up to 1 year or 2. 3 is definitely fantastic. So these are the backgrounds of mentioning every specific, what we would call as the key points in the heading itself, the keywords. I haven't included my phone number here because I do not know if it is relevant to anyone, but it can always be shared. And anyway, the email ID is there. So if at all I need to be of any help to anyone, it's very, very welcome. Yeah, I think it's always very important that whenever we do something, we should not forget our past, and we need to express the idea of gratefulness. It's dedicated to every Indian. And I just want to be making very clear that I don't have any intentions of hyper nationalism or jingoism. It's a very simple idea. Having dealt with a lot of international people, I strongly believe we keep our Indian heart, but we keep our international brain or the international spirits. And that's what I always like to make sure that it's a matter of not only a profession, it's also a matter of our pride in the right sense of it. That's why the nation first. Well, from the nation to an ancient icon, the iconic picture. This is a very clear indication that how our ancients were very great. That's all good. But my point is not to convey the greatness of Ayurveda. It's to convey the utility of parasurgicals in the present context. And I just have a point to convey here that is more with the BAMS to say so syllabus. I mean, knowing history is good. You know, it's like retracting an arrow. I understand that, but it's also very important. Apart from basking in the glory of one science, it's very important to have where are we now? You know, what is our present status? A young graduate of Ayurveda or a young student of Ayurveda definitely needs to know what the reality around him is there, what the world around him. And definitely he should be taught future. Teaching future is more important than just teaching history. And that is conveyed here. Every slide, every word has a connection to parasurgical. And that's why I would like to narrate here that in the academy, I regret to say that, and I don't want to be starting on a critical note. In the academy, we generally have a situation of lacking a connect with the reality. That's a fact. I say so because I am in engagement with these 19 different Ayurvedic colleges interns. They're supposed to be the best people who have joined the group as selected by the teachers. And I really realize that the disconnect is huge in the academy from the reality, and also from the clinical experiences aspect. The disconnect has to be brought about, deficit has to be brought about, cemented. From an ancient legend to a modern day legend, and I have two different messages to convey here. It's not just about that I was called up in 2008 to his office to stand in front of him for 15 minutes. It's not about that. It's also about the greatness he has exhibited, and I think that can be something that we can imbibe in a professional life. And he has spoken this to many people, so no, I cannot be an exception to it, because when you ask him, so how do you maintain so much of energy and enthusiasm, he tells two important things. I'm sure I'm not the only one who heard it. He says, when I meet somebody, I always think, what can I do for him? And he also says that the second thing I think, what can I learn from him or her? It's a person actually. So why I'm commenting this is I put a star mark on the word called inspiration. The point to be discussed is not parapsychology, the parasurgery at all, nothing to do with parasurgical things. It's something that can have a huge financial, academic, and status-wise implication for the Ayurvedic doctors. So we will reserve it to the last. If somebody is interested, we can talk on that. And I'm sure now our audience is slowly, gradually getting in. So it's very important to convey to you for the next 1.5 hours, what is your benefit. The very first thing is obviously the idea of what we would call as the confidence to be built up. And there's a golden rule in parasurgery aspects. There's a golden rule I always mention. And the second most important thing is to get convinced. When we try to do something different that's not very popular, we need to convince the audience. And that's my simple task to try to execute. And the most important, after this class, even if you are a plain BMS, even if you are having a non-clinical PG, if the very next day, that's the most important word. There's a very next day, if you can get into the confidence, or at least the intention, if not the confidence, to get into parasurgicals, it's very, very, very worthy to be in this class. And I would feel really fulfilled in that. Why I use this word is here, the very next day. It's a reality. We know that hundreds of Vamana are happening and hundreds of Vasti are happening, but thousands of Virechana is happening and thousands of Nasyas are happening. But how come the fifth Panchakarma, well, Siraveda is not happening that much, or if you put everything combined together, well, Kshara is not Panchakarma, neither is Agni Karma, neither is Shringa, but still, let us put that into one separate Panchakarma, if it can be called that way, why it is not happening. And this question did not come to my head till 2010 when I met Dr. Ravi Shankar Parvaje sir. I had some thoughts on that beforehand. I'll come to that. So this is the main reason why this slide is put across. And I hope in the next 90 minutes, we'll have the audience getting to that rhythm. So we get into the direct syllabus directly, and I would be making a plan in such a manner that doesn't get monotonous. It will be a situation where we will have what is described as a academic discussion, and then I will divert you. I'll come back to academy and divert you. You'll see, you will figure it out. So here you see something called Ksharakharma. The condition is very, very simple. It's nasal hypertrophy. And the question obviously is, what's it? And obviously it is a nasal hypertrophy, one lady, one gentleman on the top layer. And what is this? Obviously it is a condition mentioned, and the procedure is obviously very self-explanatory. Ksharakharma or chemical cautery. And you see the camera date, you see the camera time. So my point is here, they all come just because the ENT has said surgery, or ENT says, ENT surgeon or the physician, whatever, says that you need to use regularly steroids or nasal sprays, etc. So basically, these are conditions which are not really greatly and efficiently and satisfactorily managed by allopathy. And that's where we have to prove our point, and it is possible. And they come as a last option. They say, look, I can't be going on having nasal sprays of steroids all the time, and I need to have a normal life, and etc. So that's how this becomes very relevant, wherein we are able to either avoid the surgery in polyp and other conditions, and also give a good quality of life, and still we are competitively, financially more in an advantage position. So here, what I would say is very simple. If somebody is having this situation of internal medicine, Varanadi Kashayam, Gulgulu Diktam Kashayam, or be it the tablet of the same, and you're having all sorts of Gulgulus, Kanchana Gulgulu, Chitraka Harita Kile, all great, no doubt. But will that make this kind of a change between 5 o'clock, 7 minutes in the evening till 5 o'clock, 23 minutes in the evening? Within 16 minutes, will you find this finishing? In a matter of next 2 weeks, will you have that kind of a reduction in the size of the mass? Is very unlikely. And if somebody claims that, then they will have to prove it. So this is where we make things a bit faster and we make it a bit smarter. And that is very important. And if you do things a bit smartly, other than what is generally being done, then you gain the respect, you gain the confidence, and you gain the faith of the public or the suffering health seeker. And next, we have a very simple question. Like, when you have such a slide, I understand I need to speak as your question, and I need to put my question to you too. So there is one golden rule, which I just mentioned before. I tell it everywhere. The last 5,020 doctors or students or public, wherever I presented this. Now the question in your mind that may come, I'm a graduate, I'm not a Shalya PG, or I'm not even a Shalakya PG, and can I do it? The answer is very simple. If SP Srejit can do it, you can do it better than him. That's as simple as that. That's a simple golden rule. And I will repeat this rule time and again. If I can do it, you can do it better than me. And that's exactly what is the intention here by this presentation. Here you see again, what's that? That's your question. And you know the answer anyway, that's Sira Veda happening. Number 8 needle, agreed. And the condition is a varicose vein. And my question is now like this. When we have, tons and tons of, Sahajradi Kashayam, Sahajradi Sevium, and Pindatailam, done reverse massage of the calf and crab bandage, all so many things being done. What is the comparison between the results by Siravedam? And if we compare with what is available of the sclerotherapy, where they inject a certain medicine to the blood vessels for disease of blood vessels or for the malformation, same the lymphatic system. But when we compare, we find that the cost of that is easily 20,000, 25,000, and the needle is just costing 2 rupees. No, that's the way. Of course, the brain is also very costly. A physician's brain is very costly. So how we get into this is very simple. We convey to the patient or the health seeker that this has a lasting relief, and you may have to do it again after another 4 months. Of course, hemoglobin, etc., factors to be kept in mind, and that we have to be very sure that the effects are lasting as much, and maybe in 6 months' time, you have to do it again. I've had situations where people with varicose vein have had lasting impact till up to 1 year. So the competitiveness is not only financial, which are vice versa with allopathy, it's also about the result. Obviously, somebody is very lame. There are a lot of contraindications of the condition. Somebody has a breathing disorder, you can't do it. I understand that. Of course, the patient may not agree. I understand that. There are situations of very low hemoglobin. I understand that. Those are challenges. But generally, it has a very easy applicability. And here, what I would be just comparing again is the fact that if somebody is supposed to learn Sira Vedam, it's just very simple 3 things. One is a needle of number 18, veterinary needle as we call it. Of course, butterfly, that is fine too. But then you have a simple towel or a tort or a taulia, which can be even compared to Tornic, a lifetime investment. You can have a mug, but of course, nice to have a kidney tray. So this is again a lifetime investment. So your expense is not much. And what happens is, you know very well, like for a simple cinema ticket, you will just be spending anyway 200 to 250 rupees. So why can't you charge 300 rupees for a session of that? Financially feasible, patient is happy. And there's a limit of how much prescription, the consulting fees you can ask from a patient when you're a beginner. So this is the idea there. Coming to the point of what I would say as this Sira Veda, and even before that Dikshara, way back in 2000, when I was a final year BMS, I never saw this. So I'm using the word 2000. So this should not happen. I strongly believe as young doctors we are, or we are kind of a semi-young, semi-old, I'm 40 plus. So it's our responsibility that our juniors in terms of age, not in terms of experience, in terms of age, they are better than us. That's the simple intention of this presentation. So it is possible. Again, this is something that you see, again, hardly 10 rupees. Of course, we have cupping equipment, I agree, but to make it less costly for the patient and easy for you too, the screen you see is on the right hand side, a clot of blood, looks like a cutlet. And then you see on the left hand side, the simple, like you got the syringe, ulta, you cut off the surface, which is more sharper like, and you maintain that surface, the smoother one, the factory made smoother one, and you get a kind of a piston effect. It is that simple. Of course, you need number 12 blade, or any blade is fine. And that's it. It is so simple. So it's just a blade and this 10 rupee thing. Well, there's a demerit to it. I mean, however cost effective it is, that you need a lot of patience to hold on this manually, which the bystander can do, when you can do, but it's a bit of a task. But generally, if you have the cupping upside down, it's just easy as that. So this is why I just want to make sure that it's not that a big deal to do it. This is the simple message I would like to promote here. It's a very simple to do procedure. Anyone can do it if we keep some things as common sense understanding and some common rules. Very easy to do. So I know I'm getting too fast on subject, but I will deviate and support it with real life experience. The overall idea, of course, we know hijama, we know cupping, and we know here the syringe would cost you 2-digit, but you can always get a revenue of 3-digit. And the patient feels involved. That's you who are doing it, the doctor himself or herself. The overall idea of this presentation, I reserved it to this 8th slide, is to give you a bird's eye view that these things are quite doable, and there will be support system that you will see towards the end of the presentation. Coming to another process, it is Sneha Agni Karma, which I learned from Dr. Ravi Shankar Parvaje sir. My apologies for not acknowledging, I'm sorry to go back. My apologies for not acknowledging that Dr. Ravi Shankar Parvaje sir, my mentor, is the one who taught me Kshara Karma. And this I learned from Pune and also from Dr. Ravi Shankar Parvaje sir, and Dr. Mahesh Patil from Pune, Dr. Shivanand Thonde. They are like all Pune people. They taught me. I did not learn from Kerala. I'm not complaining about that, but it's an acknowledgement. This was taught to me by one Dr. Ganesh Malwade, somebody easily 5 years younger to me, a postgraduate student of Shalyatantra and Tripunithra Ayurveda College. And this was again from Dr. Ravi Shankar Parvaje sir. So it's very simple. In this, the Sneha Agni Karma, again I say, I did not see ever in Ayurveda College Academy in 2000. So we had to travel all the way to Puttur, South Kannada, and to learn from Dr. Ravi Shankar Parvaje sir. And it was worth visit that still has a resonating effect 10 years later. And here, the cost involved, I know I'm talking money matters, but money matters a lot. Money does matter a lot. And that's why I'm into this money matters, and we'll get into the academics of it, of course. So here you see that the cost of the Arka Patra or the Erinda Patra, that would be hardly any cost. And the cost of the oil, not more than 50 rupees. And then this 2-digit investment goes into a 3-digit income. So this is Sneha Agni Karma. But Ruksha Agni Karma is something I would say I did see in the academy, but I saw very rarely. So we never had the confidence to do it ourselves because, of course, as graduates, pre-graduate, you're not given the task of doing Agni Karma on anyone. And that's usually dealt by a PG scholar or the professor himself. So it's kind of not alien to us in the academy, but it was not very popular. And I learned it from Dr. Matthews Wimberly, sir. He's, of course, a known figure in our circles. He's in district of Idiki and one of the best figures, best faculties actually of sports Ayurveda. He taught me. And here also I would say the Shalaka would cost about 1,000 rupees. That's fine. That's how it is. Anyway, you have to spend about 2,000 rupees for a simple shirt these days and times. So it's not a costly investment. And then of course, if it's a Duke's cautery machine, 4,000, 3,000, but that's different. But they're all lifetime investments. So this was to get directly into the subject, and we will slightly deviate to a different way of doing it. My long-term objectives today, and the word is beyond. I take the word beyond very seriously, is to share all that I know. And you see that all is in inverted comma. When I say the word all, my experience is definitely limited to last 10 years only. But my enthusiasm and sincerity to your cause would be definitely unlimited. That I would have to convey to you. And why I use the word 75% of the audience, if they could do it, I understand that there will be some inhibitions. Some of you may have difficulty seeing blood. Some of you may have your own challenges with this physical manipulations. But you have to understand the fellow who is talking to you on the screen at this moment. In my 1996, after +2, as we call it, 12th class, I had two options. I could get into Ayurveda. I could get into electricals and electronics. I chose Ayurveda, not because I really was knowing a great deal about it, but because I knew that somebody who could not even change the bulb of the home when it gets fused, well, he would be terrible in any kind of mechanical things. So you're talking to somebody, or you're seeing somebody who is an average or maybe below average. That's me. So you can easily relate if somebody of you feel similar like me. That is why I want to make you convey that the first task is to format your psyche that you can do it, and it's possible. And that's why I use the word learned or relearned. And why do I use the word Vaidya-centric practice? The intention is very, very clear. When you run a hospital or even a clinic that's a bit big, you have a therapy staff, you have many therapy staffs. And in Malayalam, we call it Jada. Or in Hindi, you may say Bhav Kha Raha hai. So they become a bit too much of an authority by themselves. So when you are the one who is doing it and the greater results comes through you, you are the central theme and around which everyone revolves. That's very important. That's one thing of it. And I also have a very simple question to each one of you who are practicing Panchakarma at an IPD level, where you rely on therapists. What guarantee do you have that your therapist has mixed all the ingredients in the right manner, or if all ingredients have been even added? So I wish to communicate to you the fact that it is very much in your control. So this process is totally in your control. And the idea is that when you have the process in your control, you are the most important person there. And that's very important. I say because I have an institution which about 50 plus staff. So there's always a staff discipline aspects you have to cater to and so many such things. And why not? That is the idea. And it's my professional goal, if I may say so, that if every panchayat in Kerala or India, wherever it can be possible, there's at least 10 doctors who do these Anushastras. I think, for me, it's an achievement, it's a success of my professional life. So like many of you and maybe all of you, I have a purpose, I love it, and I try to live it. So this brings us to the point of realizing some current realities in today's situation. As I mentioned before, the idea of studying Itihasa, subject paper, first year BMS in our times, that's not enough. We need to make our fellow graduates or undergraduates realize what is the reality. And the reality is very harsh because there's a limit of income just by prescription. And we know that a beginner, well, he can charge anything he wants, but it's very unlikely a beginner can ask more than 200 rupees as consultation fees, at least in Kerala. And in some places, some patients in some areas, localities, they don't even believe in the idea of giving consultation fees. So this is a tricky situation. This is reality. I'm speaking for the beginners who are getting into practice, will get into practice. And as I say again, that money matters. Why I say that, the percentage of, or the margin of income you get from having an agency of any brand of the pharmaceuticals, maybe 17% to 20%, exceptionally 22%. I'll be really surprised if somebody offers you 25%. So how much can you earn from that? That's one thing. The other aspect too is that you have a competition. It's a competition among the genuines. You have the allopaths, you have the homeopaths, you have the siddha, you have the acupuncture people. There's a competition with genuine people. And then you have competition with the quacks. I'm sorry to use the word quacks, but then sometimes that's it is. So what happens is that in this competition, you need to survive. So that's not very easy. The life of the Vaidyas 100 years ago, with all respect to them, with all Gurutvam, was perhaps not as tough as the reality biting the Vaidyas now. So this is why this has to be in your mind. You need to do something extra and different than what is being done. And it's a fact that the struggling phase of a young doctor, 5 to 8 to 10 years. This is precisely why I opted to train every day through WhatsApp. Kids, I use the word kids because they are nearly 15 or 20 years younger to me. Fresh graduates or just becoming graduates. The idea of trying to be different and innovative. And we all know that even if you have an agency of your own, if you have the ownership of agency of your own, you still the highest you may earn is 20,000 to 50,000 rupees a month. And I must confess, I have exaggerated the last line a bit more. I regret to say that because I interact with this generation of doctors on a regular basis, I interact with the doctors who are 80 plus and who are 25 minus or 30 minus. So a huge cross section of the society of the doctors, physicians, I just get involved into. I realized, and somebody was telling me that a brilliant doctor, she's like from a Ayurvedic college, she was telling me that she has been given the offer of per day 250 rupees if she wants to join a very prestigious, yes, I won't name the name of the place, but a very prestigious institution, a very famous at least, 250 rupees per day. Are you kidding? And with all respect to an auto rickshaw driver, he's also a hard worker, I understand. He would easily earn 700 rupees a day. So where is the financial status of our Ayurvedic doctors? It's a matter that is not known till you pass out of the academy. This is best to be known before. And why the parasurgicals are not very popular. So this is what we have to think about. If something is not very popular, there has to be a reason. And what I have realized over the years, because I thought of these aspects only after 2010, one is the inhibition among doctors. And this is why I always say that if you have a situation where if you have inhibitions, you can be very sure that you can get rid of that. This is very easy to do. First, we need to remove the inhibitions of the doctors. And there's inhibition among the public. Obviously, these are a bit invasive in nature. But then when you communicate to them the benefits that you are carrying with this procedure, you can definitely make a situation of formatting their psyche. And that is very important. And I'm sure you would have realized, if you have noticed the election time preparation in 2013 before the general elections of 2014, what was called media, MEDIA, became Modia or MODIA. That's how the next prime minister was formatted in the psyche of the public. Achhe Din and such, all those good things, Ab Ki Baar, Modi Sarkar, all good things, all with good intentions. The reason I communicate this here is very simple. You need to format the psyche of the public, and that happens only when you start doing it. And the biggest challenge people would keep in their mind, I'm not a Shalyatantra PG. It's not necessary. The one speaking to you is a basic principles PG. So it's as simple as that. And you say in Hindi, no, Aadat lagani hai, aadat laga do. Get this habit and make this habit in the public. And let us be very frank about this. The entire India knows what is Pepsi and Cola, but they may not know what is Sarvangasana. So this is how you need to coin your own science terms and get into the public psyche. And the major challenge, if I may say, the most important slide of this whole presentation would be the second half of this slide, slide number 13, is the lack of awareness and the confidence of when to do parasurgical, how to do, and where to do. This is very important. So this is what we are trying to have a bird's eye view today about that. Now, all the men here, I'm sure you are used to cricket. I'm very sure of that. And in the fact is, Dr. Shyam, I did not verify if I'm clearly audible or I'm not seeing any chats or whatsoever.
Yeah, you are audible.
Oh, okay, good. Yeah, please interrupt me. I'll keep the mobile also near.
Yeah,
in
sure,
case Dr. Rahul needs to know. Let me see. I have put it offline. Let me make it online so that, so that Doctor, I'll just have a look. I don't want to make sure. Yeah, that's fine. Anyway, we see Virendra Sehwag. All the men know. I don't know if the ladies are fond of cricket, but all the men know that he was one of the most dangerous openers in Indian cricket's history. And why I put that here. You don't have a second chance with any patient. You have one chance and that's your last chance. You need to always make sure that you get the confidence of the patient in the first week itself, maximum 2 weeks. Unlike a government institution where you may have a possibility to have the patient come back again to you in private sector, it's not a guarantee at all. So this is very, very, very important. And why I say this, there is no place for fear and there's no place for the weak. In this world, only strength respects strength. And strength comes only by making more experience, and making more experience comes by regular training. And that's what we have to make sure that is conveyed to you in the long term. And why I would say that the possibilities of the parasurgicals, and this I would put as the second most important slide, but I brought it quite later, is that there are many conditions, 40 to 50, and all of that is in my website that you see in the right side bottom, at least 40 to 50 conditions. Most of those who do parasurgicals, we have made that list, a common consensus, which are not satisfactorily managed by allopathy. And that's why I put that in red color. And this is the area where we have to work upon. Because there is a 50% cost decrease when you do parasurgicals in the general practice in the expense incurred by a patient. And the results are easily 50 to 70% faster. And this was not the trend quite some years ago. So this is important factor. The other aspect is that quick relief. So what happens is you can't assume that a patient who has met you today would be retained with you for more than a month, or maybe not even more than 2 weeks. So that patient retention is so important, not only for getting results, but also for the confidence to be gained, but also it's very important for what would be called as a future possible income through referrals. This is so important. And that is why the parasurgicals have a fantastic role. And apart from that, you get an image or a reputation that you're doing something different. Well, it's nothing different for Ayurveda, but from the normal practice. And that brings me to the point, many people ask me, well, with parasurgicals, will everything be cured? Well, I would say that in the case of Kshara Karma, I may say that to a good extent with Snehagni Karma, but I won't say for all parasurgicals this aspect, simply because it's like this. In T20 match of cricket, you need to be just very fast, radical, and quick making runs, amass runs. That's what I would put parasurgical for. That quick relief and that giving a sense of confidence in the mind of the patient. But when it comes to your overall long-term healing, Panchakarma would be very relevant, or OPW medicines would be very relevant. So that's like a more like a test match, and you get it better when you make sure that you gather the first momentum fast, and then you capitalize, consolidate on the improvements you have gained. This is how it becomes relevant. The important factor is that we cannot take it for granted that somebody has what we call as the assurance, okay, I'm going to stick on with this doctor. Very much not possible all the time. So some quick questions. Again, this I would normally ask for, how to say, the interns who are getting out, for youngsters. And I ask myself also quite often, even after being independent for more than 18 years, I ask myself this question time and again to make sure I'm still in the field, I'm in the competitive scenario. What is your worth for yourself and for the society? That's very important. Where do you see yourself 1,000 days from now? Nearly 3 years. We all know the elections are being fought 3 years ahead of the next elections. So if the political parties can think of the next 5 years, why should not we think of our life in advance? So this is very important because it helps you to reflect and contemplate. And the most important thing, how much earning do you make per hour? It's not about months or weeks or days. We need to be that competitive. If you do a parasurgical situation, you need to have a calculation. This much is what my investment is and this much is what I want to earn. So that gives you a sense of pride, a sense of worthiness, because time and again, the financial weakness is quite high in the community that I have seen. There's a lot of disappointments, there's a lot of depression, there's a lack of enthusiasm because the amount of knowledge and experience they have in their academic life is not getting translated into a financial bonus or a blessing. So this is precisely why I use the word per hour. If lawyers can go for per hour, why can't doctors? This is right. I don't mean to be commercial, but then it's very important that we make ourselves feel worthy. That's very important. And how do we figure out the entire agenda for this session? My objective, of course, would be to break the inhibitions, to encourage you to start, and support you in the long run. There's a mechanism that I already have in place. And if God willing, to train, and to train. You see arrow 1 getting to a couple of arrows and then 3 arrows. It's very, very important to communicate that what a few of us started in 2010 has a bigger ramification now at the moment. More and more people are doing it and we are very happy about it and very satisfied about it. But the chain reaction has to go on. We need more people to get into it. And how do we get it? The very first step before you think of making money is your academic excellence, your thoroughness. You say in Hindi, kaam seekhna hai, and Kerala will say, pani padi kiwa. Pani padi chillengil, nothing will happen. If you don't learn the best of the practice, you can't go forward. And there is a need of a financial smartness to it. And I would say it very simple, as I said before, a simple cinema ticket is costing 200 rupees easily. Why can't you charge 300 rupees for a Siravedam that can have a lasting impact for at least 3 to 6 months' time? A simple pizza, which you may call it junk food, would cost easily 600 rupees. Why can't you charge half of that for your knowledge and your expertise? So this is how you need to be financially, smartly putting it across. When I say these financial figures, I don't mean to be less compassionate towards the poor class people. I deal with people who don't even earn 10,000 to 15,000 rupees a month. These are my people in the government sector, government service. I always used to donate 10% of my salary to give free medicines from my side to these patients. So I don't forget that. Let me be very clear about it. At the same time, I had the opportunity or still have the opportunity where people don't mind paying up to 8,000 rupees a day for staying in our IPD setup. I'm saying this to you. It's very important to be financially compatible and financially affordable to all the strata of the society. It's very important. And that is why I use the word financial smartness, because it's a long-term strategy. Parasurgicals is not about the subject only, it's about the allied aspects to it. And there's a socio-medical impact that we need to make. And why I say this point to you, when I started this in 2010 in a place called Vaila, that is Kottayam district's inner village area, it went very popular. to the extent some patients would come, Doctor, simply translated into Hindi or English, doctor, can you please take out blood of my cousin also, or my relative also? The public, it goes by word of mouth. The public knows the advantage to the extent, just as some people come to Ayurvedic place, say, I need a massage. People say, can you please get this for me? Can you please get this bloodletting done? That is the way we have to make the impact in the socio-medical context. And even Agni Karma, I have had many patients telling me with tennis elbow and such conditions, they say, which simply means, can you please burn him also with Agni Karma? That's the impact it makes. And it's very important to gather the public support in this. Why I say this to you, many other allopathic doctors, they're against these parasurgicals. They say that it's not Ayurveda and this is outdated, and they say that it is not scientific. So it's not about knowing what you know, it's also about doing what you should be doing with the correct social smartness to it, because there are hurdles that comes, and I don't want you to be surprised, just as I was surprised initially. And what is more relevant is that how do we convert a 2-digit investment into a 3 to 4-digit income? This is very, very important. And this is what I have mentioned before, and in the coming slides, you will figure it out. So it's a very simple question. I'm sure the answer has to be car. For a journey of 300 kilometers, what would be our preference? Unless somebody is extremely conscious about environmental safety and environmentalism, car would be the option. This is what parasurgicals do. They enhance the rate of recovery and the results come faster. That's why it's like you change the gear from the 2nd gear to the 5th gear. That's the way it works, very fast. A short break because we already had about 19 slides, and it's very important to realize how can I be useful to you. You have the website, these many are the subscribers, they are making good use of it, and it's all yours. I always belong to you, I always did, even now also, and in future too. This is the best way I can help you for further things. It's very self-explanatory. This is the group I was talking about, one of the 3. The reason of showing this here is CR. In the corporate industry, they call it corporate responsibility. I would prefer to use the word cultivate responsibility. We have a responsibility to help our fellow members, our fellow Vaidyas, so that we can all grow together, which is what Pampa is already doing for a long time already. Somewhere in 2005, 2006, Dr. Praveen Pitamban, my batchmate in the post-graduation, he was telling me, Srijita, namakku technique vanam technique. And the context was about, he's no more with us, Dr. Mohan Kumar sir. This doctor saw in front of Dr. Mohan Kumar sir in Thrissur Vinayaka Hospital how a chronic low backache responding to nothing got a very instantaneous relief by, I think it was cupping that was done. But I did not know those days cupping. He said, Mohan Kumar doctor in the front and blood. So I was just wondering and I was puzzling, what is he talking about? And then he said, namakku technique venam technique. That brings me to a legendary exponent, somebody who we should say in our mind, dear sir, thank you for your service. Because more than 20 years ago, when Kerala was not in the psyche of parasurgicals or such kind of practices in a big manner, Dr. Mohan Kumar sir was the pioneer. And the greatness about him, I never met him in person. I regret the fact I never met him in person, but my close friends are his close friends. So they always said he was an authority, but he was very humble. He was an exponent, but he was very magnanimous. He taught almost everyone, rather everyone who went to him to study. I think we should make him as a role model because we have responsibility to our juniors. That's what he had. And for me, I see with a lot of happiness, Dr. Shyam Mohan is carrying his father's legacy in a very fantastic manner, in a slightly innovative manner, in a digital manner. I'm very happy of that. It just is an indication that the future of Ayurveda is very safe in the hands of very brilliant people. And that's a teamwork we all will carry. So now again, back to the medical stuff, as I would call it. It's about tennis elbow. All of us know the typical diagnosis that made very famous by itself due to the fact that it was affecting the legendary cricketing maestro Sachin Tendulkar, Bharat Ratna. Obviously, we all know the symptoms. You have pain in the elbow, left or right, lateral epicondylitis, you may say, and you may not even be able to carry a small bag of your child, which may not be even 1 kilogram, and such things. I understand that. These are symptoms, and you may feel a trigger point as a sign, and investigations don't hold a lot of importance here. And then you're using medications. It's very effective to use Gulgulu Tiktam Kashayam. You use Gulgulu Panchapalam. Vetumaran Guliga with coriander water is effective. Vetumaran Guliga is a Kerala special medicine from Sahasra Yogam. Well, you call it Siddha, you call it Kerala, Tamil Nadu, but it's easily available with big brands of Ayurveda. And then you use Brihatyadi Kashayam, you use Lepanas, Virayamadi commonly used, Grihodamadi sometimes Kotanjukadi, you may mix Dhanyamlam, you may mix Gomutra, all said done good. But if it's a coolie class person who has to make everyday meat, can he wait that long for our medicines to act in a week's time, maybe a 5 days time, maybe even 2 weeks time? Well, in my government service practice, I have seen out of 100 people, nearly 85%, 80 to 85% would say the relief starts from the 3rd day or the 4th day. So that is our experience, agreed, no discounting that. But then, how long does it last? We're looking for that. So in those situations, I realized only after 2010, I'm using this word 2010 because after 2001, I passed out. And then for the next 9 years, I now regret the fact, why did not I know these techniques? And that's precisely why I thought it should be done as early in our community by a lot of other young doctors. So there comes the role of the procedure that we are going to discuss about now. We take another example of calcaneus spur, the very common condition of somebody very correlated with plantar fasciitis. And if I may just show that like this, you have the entire plant. This is palmar, agreed, but if you take the entire plantar fasciitis aspect, the patient gets up in the morning. This is chatti narakua, which means like, limping gait for a few minutes, maybe a few seconds. And then it gets better by a lot of movement, and as the sun is more prominent with more heat, agreed, that's happening. But there's always a recurrence when you stop the medicine. So when you know the prescription is, even if you try to limit yourself, 50 rupees a day, it's still 350 rupees. And that's quite a lot for many people to handle. So this is where the role of the Ruksha Agni Karma comes. This process has a fantastic benefit to make in this condition. It's very easy to do. It's very easy to do. The only thing you need in this situation is that you take a newspaper, use an agarbatti, and if you don't puncture it out very deep inside, you don't cross it over, you're kind of qualified for Ruksha Agni Karma. Very, very important. The fact of the matter is also that many situations we inhibit ourselves by the fact if we will overburn. But if you practice enough on a carrot or a brinjal or a banana, you will get the confidence of different skin texture. It's that easy. And of course, you see the equipment, that's so clear cut. I would just leave it like that. You have companies, you have even Vaidyas who are making shalaka. Doesn't have to be always Panchaloha shalaka. Even without gold, things can be done. And it is very easily available. The cautery machine is available. So many possibilities are there. And coming to another topic, chronic low back ache. So here, of course, we are not going to forget the fact that we all are aware 12 medical reasons. In surgery, we study 12 surgical reasons. And we all always aware of the fact the head oil we use can have an effect on the musculoskeletal system. It can go from the neck to the lower back. So we are aware of that head oil's role. Shita Virya head oil, like Brinka Malakadi, Kshirabala, Balaguluchadi can cause a low back ache if done in AMA stage. We don't forget the fact that depression and stress can cause low back ache. We know a chair, a simple chair, if it's not the right one for you, it can cause low backache. A chair or a car seat can cause low backache if improper. We also know somebody with a pot belly. If he's done Udvartana, his low backache will go away because pot belly is pulling at the lower back, if I may use that word. We are aware of the fact that internal piles can cause, the lower backache, and we are using Chirula, the Kashayam, Abhyarishya for that. So we keep all these reasons of low backache in our mind in common practice. However, we will also end up in situations of what we will call as inflammatory. Those are the pain and inflammatory conditions of low back are the ones which are more when you get up in the morning. You find relief by hot measures, Ushnavirya actions, be it a simple salt, potli, piri, and hitting the area, one possibility that helps you, like such which are inflammatory or ama scenarios. We also know that if it's degenerative, it's more on activity, so we need Snehapana to that, so we keep that in mind. And if it's really the Majja involved, Dhatu involved, the pain will be constant. So we keep all those factors of low back in our mind before we commit ourselves to the trigger point. This is a very tricky area, and many patients don't find relief simply because their trigger point was not destroyed by Sneha Agni Karma. That's what I'm coming to. Obviously, I've made the note of a non-oncology. When we say non-oncology, we all are aware in our practice that you're treating somebody 60 plus, 65 plus, it can be a bit earlier too, and then the gentleman's low back is not getting away. You try the medicines a week, hardly response, usually shows some relief in about 3 to 5 days time. Definitely in 2 weeks time, there's a noticeable difference. In 3 weeks time, there's a definite difference in improvement. And after 1 month, if you don't have any improvement in the low back ache, you think of taking an X-ray, which you really don't want to spend that money for the patient initially. You take the X-ray, you end up seeing a multiple myeloma scenario, and the skull X-ray can also prove that to you. So we keep that oncology angle in our mind before we get into this, the parasurgical Sneha Agni Karma. This I learned from Dr. Ravi Shankar Parvaji sir. Why I am telling this here is very simple. When you need to destroy an enemy bunker in military, as we say, there's no point using bullets when you have to use rockets or missiles. This is the point I need to convey here. And why I say this to you is that there is a lot of scenario where the patient is treated left, right, center. Of course, I have not mentioned about Snehapana's role of Shavana Snehapana or 10 drops of Nimbamrati, Erinda Taila or Gandharva. I have not mentioned that, but still. When we are exhausting all our measures and our resources, which actually deserve a shortcut like parasurgical, why should we waste the time, money, and faith of a patient? This is my point here. Simple as that. So, well, this is, I put as drug preparation 2 because the drug preparation first is the Ruksha Karma. So, this is very simple. All that you need is Arkapatra, and if not available, you can use Erandapatra also. It's a possibility, and you need oil. And the video of that is in the website because I need to complete the bird's eye view in this stipulated time. And it is such an easy process to do, wherein you will cut the pieces of this leaf and then you boil it, and then you will take 2 leaves, actually 4, 2 plus 2, and then that hot boiling oil is banked on top of the trigger point. It gives fantastic relief, absolutely fantastic relief. So this is so easy to do. Of course, you have to imagine you are making more than 100°C boiling oil put into a specific spot. So it's a very responsible and accountable task. Very, very important. Coming to a slight deviation, because I thought it's important to mix social, medical together alternatively. Now we get into some social aspects like, are we unavoidable to the public? When we come out of our graduation or before that, do we ask ourselves this question? I never did. So I really wish that our next generation people think about it. We are on slide number 31. 3/4 of the presentation is over. And I don't see any chats. I think the chat messages are reserved towards the end. So if the answer is yes, how? And if the answer is no, why not? Are we, unavoidable? The reason I say that I've come across doctors who have earnings of up to 5 digits easily in a single day. That 5 digit can go up to 50,000 easily, single day, easily. I know of doctors. And then we have doctors who are like 500 a day. So there's something that's missing. There's something, both handle the same science, something is missing. And that primarily comes by the fact that have we realized our strength, clinical strength, and have we realized our weakness? When I say strength, in this world, only strength is respected by strength. And we have to be very clear of what we can do so that we make the right kind of promise and what we cannot do. It is very important because people respect you if you just upfrontly say that this is something I may not be able to do, and that gains more popularity and more credibility, and which is very important as a young doctor. This presentation from me is primarily intended for doctors who are at least 10 years younger to me, 30 minus, so that we get the right kind of conditions for them psychologically. And introspection is very simple. We need to have how much variety of ailments do we manage or cure effectively. It's a very, very important thing. It's what I would say, these are the compelling reasons that gets me into this parasurgicals. It's a research. It's not research, it's a researching. And are our methods affordable? Because I've realized that we have alienated ourselves quite a bit by being very costly therapies and costly methods to adopt. So unless we reach to the middle class and lower middle class, it's not easy. And why I would say that, I deal with coolie class people, they earn about 700 rupees a day. And forget all that, my own mother, she's a retired principal, central government service. I sometimes think with her pension, which is about not more than 50,000 or so, she's happy with that, that's a different story. But if she gets admitted to an Ayurvedic hospital of her own, without any support of mine, do you think that a retired principal can afford to have her or his, in spite of so much of education, right? Medical details taken care of very well with that limited income per month. So this is what we need to think about. And parasurgicals help a lot. I understand the fact that I have mentioned 50 rupees per day expense. If we can maintain that, it's always great. But I also understand the fact that the legendary Dr. Muralidhar Sharma sir, Udupi, he's retired from Udupi, he practices with per day expense of 10 rupees. Well, that's a great blessing and capacity he has. So we know there are doctors like that, but that's very, very handful or maybe very rare. So this is why I would always convey that we need to justify the money and the time and the faith a patient is investing on us. When we compare money, we meet a homeopathic doctor and then it's so cheap. You can meet a doctor, come back with just 150 rupees, including the medicine and the consulting fees. Our one bottle of kashayam would easily end up being 100 or 120 rupees. So this is a challenge. In terms of time, we have a competition with the allopathics. Quick result is there or not. In many conditions of parasurgicals, 40 to 50 different conditions, I realize many occasions we are better than them. So when I tell to the patients, so does my friends, we say very simply, "Idu Ayurveda, adundu valare fast aanu. This is Ayurveda, so it is very fast." This is the way we communicate. That's the experience normally. But apart from all that, the most important, the faith. The faith of the public is getting lost from Ayurveda many times. The reason is simple. I hate to say this, but that's the reality. I've heard, I don't have data to prove, but I've heard from many of my friends in other parts of India that outside India or outside Kerala, not 100% of the Ayurvedic practitioners practice pure Ayurveda. They even say it could be 20 to 30%. So this is how the public is losing faith. But I strongly believe if you practice the original Ayurveda, you have a high chance to gain the faith. And unless you have faith in the public, the policymakers would never have faith on you. And the policymakers don't favor you. If the government is not favoring you, then you've had it. Without the patronage of officialdom, the progress of any science or the welfare of its doctors is very, very doubtful. And this is precisely why I thought this slide should be shared, because this is something that we don't study in the academy, and we think about it only after 10 or 15 years into the clinical practice. A short break, because that is to just communicate to you. If I can be ever useful to you, this is already in my website. I had a fantastic, because along with parasurgicals, this is also my very favorite intention or long-term plan for the Ayurvedic community. I had a chance to do Kuti Pravishikara sign on me for 35 days once in 2014, and 2018, 64 days all alone in a dark room. And it's a fantastic experience, and I strongly feel that many people can get into it. We need more Vaidyas who are getting into such special practices. This has nothing to do with parasurgical, but since it is a topic that can also add to the charm and popularity of Ayurveda, I just put a simple slide. We already had 32 people who have done it out of nearly 90 people in the entire world. It's just to communicate to you again our cultivating responsibility for our fellow Ayurvedic doctors. Coming to the next topic, this is a situation where tonsillitis is recurrent. I am reminded of a lady. She was having tonsillitis like a monthly cycle, like a regular monthly cycle, every month for almost 8 years, to the extent there's a very famous hospital called Caritas in the district of Kottayam. The ENT surgeon said, look, either you get the tonsil operated by me or you damn don't come here again. Yes, he was very harsh and he was very rude. And that was 2010. And I too was waiting for a chance to do Akshara Karma. And I realized that very next month, the tonsillitis did not happen. On top of that, it's nearly 10 years now. From 2010, she has no recurrence. The interesting thing is that she used the internal medications only for next 2 months. And then she stopped because she became overconfident. And a year later, I was transferred from that village government Ayurveda dispensary to the district hospital. So, but still I have the phone number. So I made a contact to know for my academic interest. So this is about the impact. So here, Ayurveda was a better option and the cost was negligible for her because it was government sector. I did from my own side, so that was easy. In similar measure, there are many patients who have nasal polyp. And the challenge with the nasal polyp is that it's not very convenient to have an ENT anesthesia. It has its own share of risk, as told to me by an anesthesia specialist. It also has a challenge that if you're going for surgery, it may be as low as 16,000 rupees to up to 25,000 rupees, depending upon the status and the popularity of the hospital. But for a cost that is so low in comparison to what is being paid by a patient for this nasal polyp, the effect is so great. You can do it without losing the working day of the patient, simply because you can do it even after 5 o'clock office time of the beneficiary. That is one, doable at an OPD level. The advantage is that you save the money of the person, you have saved the working days, no hospitalization needed. The follow-up is needed further on. You have a more contact with the patient, and then this patient can bring you more patients. And that's a win-win situation. And you see how the impact goes on more and more, and that makes it easier. So this is how the role of the Akshara Karma comes. This is where we can make such an important and effective impact. This brings me to the point, to the same slide that has happened before. This is before treatment, after treatment, you see very clearly. And these are tangible evidences, apart from the impact that is happening to the patient personally and the subjective improvement the person gets. There is a objective finding, an objective proof. And when you take pictures like this and you display in your clinic or whatever, it just gives a good confidence and a sense of faith towards you from the patient. And that's very important, because parasurgicals, you need to gather the confidence, very, very important. So I would easily compare something that may not be 5,000 rupees from the Ayurvedic side. Of course, the cost of the medicine is not that much and other things. and there's a comparison of 25,000 rupees maximum from the allopathic side. Obviously, you can even tell, because it is kind of a nearly apunar bhava, you can always say, okay, 1 year guarantee or 2 year guarantee, and the patient feels of comfort, and he may even bring more people to you because you're offering something that's not offered compared to the regular steroids and all those processes and the surgeries. Of course, there are failures. I don't discount or deny that, but that's how it is. Now we are coming to another, I won't say parasurgical, it's a proper panchakarma, and it is a bit inappropriate to call it anushastra either. But anyway, it's something that needs a skill, it's something that's invasive. We're talking about sciatica, a very common condition. Again, of course, we will rule out the idea of oncology to it. We rule out the abscess by tuberculosis. We'll rule out multiple things which are oncology related. We'll get straight to the Grudrasi aspect. And this reminds me of a doctor, one Dr. Sethi, a good friend of mine in Thrissur district. So he was, or rather he is, a student of Dr. Ravi Shankar Parvaji sir, and he happened to do his internship in some private Ayurvedic college in Kerala, wherever it is anyway. So what happened, the patient was not finding a lot of relief, and kiri after kiri were being done, and he requested to the medical superintendent or somebody in charge that, sir, if you allow me to do Shira Vedam, I have seen the results. Ravi Shankar Parvaji sir is treating sciatica patients in 12 days time package, 12 to maximum 14 days. I think Shira Veda is very much ready to be done because neither Snigdha, nor Ruksha, or no Ushna, or nothing is helping. So will you permit me, please? He was denied the permission quite a lot until a day before the discharge of the patient. Then the unit chief said, okay, damn, we have tried everything. Now you do what you want. The Shira Veda was done. The relief was immediate. And then the patient said, the pain was like a matter of 15-20 minutes. So much was the relief of the pain. The patient said, which simply means that, are you doing it now? He said some bluff academically, and the process for success, and the patient left happy because it's always very ugly feeling on the day of paying the bill, the condition at the time of discharge, very important. So this was one big reminder to me again, that when we talk about Grudrasi, there's a definite indication in the textbook of medicine of Shira Veda to be followed by Vasti, to be followed by Agni Karma. Mostly it is Sneha Agni Karma. Why was that not happening in one of the biggest Ayurvedic college of India, that is Government Ayurveda College Trivandrum in 2000 or 2001? Why was it not happening? And that institution, which is my alma mater, was created way back in 1889, one of the oldest Ayurvedic institutions in the world. So this is why I thought I should volunteer to take this class. It is so easy to make Shira Veda because Shira Veda has a great impact in the psyche and the body of the person, so easy to do. Also, there are many situations where you have people with recurrent abscesses. The list is long of the indications. It's all there on my website. I just took 2 off from each, wherein we see that the person, you take tons of Padola Diganam, Avipati Churnam, Kaishara Gulgulu, and whatnot, Guluchadi, everything great. But then the patient is not having a sustained relief. The fact is very simple. When the Rakta Dhatu itself is vitiated, how do we expect the Rakta Prasadana to happen? So instead of wasting tons of what we call as herbs and time and faith of the patient, let us do something that cleans the blood itself or removes the bad blood. That is why the role of this comes. I remember this, a friend of mine, one Dr. Mahesh Patil, his name in Pune, he was telling me that a good friend of his, even though he was an Ayurvedic doctor, he was a kind of a Vyajan, I won't say, it's like a GP in the slums practicing allopathy, perhaps better than the allopaths themselves. So it was Diwali time, and he happened to meet him, and then he saw, tumhare muh pe kya hai, etc. And then he was all khujli and all itching and all over pruritus and eczema kind of situation. He was itching most of the time. Even when the Diwali time, he was itching. He said, kya ho raha hai? And he said, tune Shira Veda kiya? Did you do Shira Veda? He said, no. He said, okay, Bhabhi, he told to his wife, please bring the ghee and the milk. And before that, you get a hot water shower. Come, have this milk and ghee. I will do right away Shira Veda, because he always carries this in his first aid kit, Shira Veda needle. So he went for that. Such was the dirty blood that was coming out. The lady said, like a scream, the wife of the patient, इतने गंदे खून वाले के साथ मैं जी रही थी. Like, was I living with such a dirty blooded person? Such was the frothy, the blackishness, it was so disgusting. So I was thinking, what is the point of wasting tons of medicines when the first step to be done is Siraved if it is doable? That is how I was really inspired by that incident to get into Siraved in a major manner. And this is what was being discussed. I'd put the clinical condition first before commenting on that. So Siraved is very simple. You need a kidney tray, simple. You need a tourniquet, simple. And you need a number 20, so number 18 surgical needle, which is the veterinary needle, if I may call that. It's so simple as that. And why I would say this is that this is a very effective therapy. You see different kind of bloods, and the black blood you see, which is basically very black. Now this is like you study all the Rakta Dushti. I'm just looking at the mobile in case there is any message from Dr. Rahul. No, there is none. I imagine things are going smooth. Dr. Sham, I hope things are going smooth.
It is.
Yeah, okay,
Please
fine.
continue.
I'm just looking for the sake of verification. I don't find anything from Dr. Rahul. Okay. So you see the different shades of blood, and the bottom fourth left-hand side, you see the Grathita. Just above that, you see the coal tar black blood above that, and then the fine blood comes from the toes, rather the dorsum of the foot, of the left foot of somebody. So you see these pictures, and you see on the top right-hand side, 4 different shades of blood. It's all real blood. There's no photoshopping to it. These are all realities. The reason of communicating this is very simple, that it is such an easy process to do. And these are the possibilities which we can easily cater to. And here you see, I am reminded of a situation. There was a patient from New Zealand. He was chronic gout, and there was an acute flare-up. And all the Vastis done, Kshiradhara's done, Karaskara, Kshiradhara done, the sugar dhara done, everything possible done. Lepanas, Chada Mayadi, you name it, all done, nothing happened. Then I offered him, do you mind, because when you deal with foreigners, as much as you deal with Indians, the consent seeking is very important with every class of people, be it your town, your state, country, or outside India. So I said, well, if you are okay, we do the Siraved. He said no. I said, okay. He reached a stage where he could not even walk outside his room, and even his hand was in deep trouble. He could not even flush the toilet flush. I said, what now? He said, okay, do it. The Siraved are done, and he asked me within next 7 minutes, doctor, when are we doing the other limb? That's the impact. It is so quick. So this is one example. There's another simple example. I don't know if it has come to your notice in the website, if you ever saw. I'm surprised that a certain video on gout, which was uploaded about 5 years ago, and seeing blood is nobody's favorite. It's very ugly and dirty for many people, even though it's very important for us. Even such a ugly, vulgar looking, dirty video, it generated nearly 2 lakhs views, more than 1,90,200 something. And that brings to the point that if you really do things in the right manner, there will be enough seekers for your technique or technology. You just have to have the faith to do it, what is told in the textbooks of Ayurveda as it is. And I'm very much convinced that if we have the right timing of doing the right thing, the results are invariably right. Of course, there are failures. I don't deny that. And you see a different picture. Nothing pretty, I know, but you see like the frothy, very clearly, you see such a dark blood. And the impact is a long-lasting impact for most of the time. So we have reached kind of the 45th, there are 5-6 more slides before we get into interaction. I have used the word tennis elbow with a star mark on top, on the right-hand side top. There are many situations, tennis elbow, where they come, look, doctor, I already had steroid injections. Is there any way you can help me? They say the steroid injection I took, the effect lasted for 2 months, 3 months, maybe 6 months, it comes back. This is where Stringa is very effective. I'm taking conditions which are very, very common, because it's better to start treating common conditions because the demand is more and the effect is great. So this is where the role of Shringa would come. And it's also very common that many a times in even carpal tunnel syndrome, the patient would say all the numbness, the three of this. They may say that scooter, that accelerator not easy. Some say I can't really get the opening of the bottle such. Some say that no, I'm cutting carrot and beans and vegetables, and after about 2 carrots I can't cut more. They say they have all the numbness, all everything known to you about the carpal tunnel syndrome. There also, this is very important because you kind of release the compression of the sheath by this process. And what happens is, of course, you need to redo it again after 6 months or so, but then people are willing for doing it because the doctors give the feedback that I have spoken, interacted to, and also the patients, they say that no, they ask for it to be done again. So it means that the patient is coming back to you, you're retaining the patient, maybe he or she brings more patients to you, which is very important. In conditions which are localized chronic LBA with severe tenderness, we need to use such techniques because no matter you use Cotton Chukadi Churnam, that's Kerala special. If some of you are from north of India, Cotton Chukadi is a very Kerala special. You use Jatamadi Churnam, you use Rasnadi Churnam, all Lepans, all Kiris. When you compare the cost involved, I mean, the Lepan would cost, 100 grams of the powder would easily cost you 100 rupees, if not more. And you use the Kiris, you have to charge at least 200, 300 rupees for a Kiri. You have the manpower which is being utilized, and all the expenses allied with it. But then if you can make it easy by Shringam, why not? And it is so easy to be done. And you see the process is very clear here. You can always use the cupping instrument, obviously, the best, glamorous, effective, deeper, and looks nice. God forbid, if your patient is very poor, and then you can use this simple syringe. You just have to cut it off. The video is in my website, very easy for you, and such an easy process to do. And all these things, mind you, has been done. I use the word mind you, please. I have done it. I'm an average to below average fellow. My mechanical skills with hand are not really great, but if I can do it, you can do it better than me. That is for sure. And this is about Shringam. I mentioned the 2 conditions, and I mentioned what exactly it involves and how it looks like. It looks like a cutlet, like a blood cutlet, and people feel it has a psychological impact too. I have seen many patients, they say like, I don't want to see it. I'm allergic to blood, I have phobia. But there are many patients who say that, doctor, I want to see all my toxins come out of my body. Can I take the photo or the video of it? So they kind of visualize the toxins are going out of their body. And that also has a very good impact in healing. So these may look vulgar for many, but it's very soothing for many also. This is what I have seen. One thing I did not mention in the context of Kshara, I don't want to go back to the slide, but if somebody could remind me one very important point so that you can avoid embarrassment yourself. And again, a short break before we finish in the 48th slide, 2 more and we are done, at least from my side. How I can be useful to you. I am currently, with the help of a team of dedicated 60 doctors from different parts of Kerala and outside, we are together documenting 60 years of experience of India's oldest oncologist, Dr. C.V. Matthew sir. He is 1949 to 1954 MBBS. But why I am mentioning an allopathic doctor here, he is a great devotee and a great fan and a great well-wisher of we Ayush people. I won't use the word Ayurveda, Ayush. He does use Ayurvedic, Siddha, Unani, Homeo medicines in the practice of his oncology. And being the most experienced in India for sure, and still working in the best of health possible, touch wood, he has devoted his energy and endeavor to popularize Ayush integration into oncology. There is some resistance from the allopathic side, that's obvious. But I thought if I can be useful to you, this is also one of the method, and everything will be published and shared to all the groups, and the knowledge is free. It is made in such a manner that we want to encourage more Ayush doctors to enter into oncology, because that is one area that we have not got many faculties getting into. Even very experienced Ayurvedic doctors, they don't involve into that, but the way we are documenting it would make it easy for a final year graduate to a postgraduate to a young practitioner to a senior practitioner, even a very old practitioner of Ayurveda to get something or the other from that work. So this is how I hope to be useful to you, because it doesn't matter what my profile is or the narrations the organizers have made. All that matters is how I am useful to you. So I would be concluding it on a very social note. And about the oncology, I just forgot to tell, in my very limited time, I have been personally witnessing cases. Nearly 50 varieties of oncology. I know there's 250 varieties in types in oncology, but I have seen only 50. And more than 600 cases lively seen, and more than 4,000 cases have been already documented. It's all going to be for all of you. It's all for all. This is just a simple ethos. When we conclude, it's very important that we conclude in a positive note, in a very, we say, pious note, that we have a responsibility to learn, to teach, to serve the patients, and then to prosper. And it is a possibility. I can say it from my own experience and experience of many doctors. So the last slide, technically speaking, based on the curiosities, I would just request you to navigate your attention to the right-hand side of the slide, bottom, agnivesh.info. It's all yours now. The PowerPoints of the topics, I made a bird's eye view, but the PowerPoints of the topics are all there. The videos are there. And whatever I had taken class in when I was invited to the Cortical Ayurveda Shala Convocation Ceremony 2018, everything I know is there. So it's all yours. My task of this presentation was to communicate to you that it is doable, that it's easy, and it is very practicable for anyone at the level of graduation. And the psychological, if I may use the word technical support as follow-up, that's why I mentioned the website agnivesh.info. So it's all easily doable. And I have to really be frank with you. When I started doing these parasurgicals, I had no website. The first time I was doing Sharakarma, my hands were shaking. I had not seen much cases, hardly. And when I was doing Siraveda, I was praying that everything goes well for me and the patient. I had my share of disappointments when I overburned somebody, miscalculation in Snehagni Karma. I've had my share of failures, embarrassments, and difficulties and whatnot. But I really wish that doesn't happen to you. That's precisely why the website is made, and you can always use that. It's there since 2012 anyway. Last thing, we started as a dedication to our Indian system. I would complete it with a dedication to one of my very important mentors. Every mentor is very important. He was a legend. He was a great soul. He revolutionized Tridoshas in the academy. He brought Kutipa Vishwarasayana. Perhaps the first documented case is his in 2002 in Raja Healthy Acres. I was taken there to see one day as a young intern, 2002. And he was a great man. And what he always said to us, not only we should prosper, we should help our fellow brothers and sisters also to prosper. Dedicated to a man who is not among us, but I'm alive professionally because of him and also because of many other mentors. I think at this point, everything done. I have made it in such a manner that by this slide, I always prefer that when I meet somebody or a group of people, I become irrelevant to them as early as I can. And that's what I want to do. And I am absolutely now confident that if you have the enthusiasm, the website will help you to, take action further and further. Everything is there in that. I think, Dr. Shyam, that's it from my side. And
thank you.
I'm ready for anything else. It's 9, and the way we thought, 1.5 from my side and half from the audience. I'm all yours.
Yeah, thank you, Dr. Srijit. Wonderful presentation. I'm very sure it's an eye-opener for a lot of the young people who are getting into, the field. Thanks for your honest reviews and suggestions. Before we go into the question and answer session, let me just remind you about the class that we are having. It's called Pamba Mastery. It's on Marma Chikitsa, and this is the first of its kind that we are having on our platform. We have 3 modules in that: the basic, the diagnostic, and the treatment aspects. So we will be covering all the 3 modules on different dates. We are starting the module 1 on the 16th of this month. So we'll be having an introduction class on this Monday evening. So all are welcome for that. And once you are convinced that if you are interested, you can join our course for this. The entire course fee is 2,500 for all 3 modules together. And we are so proud to bring that to you at this cost. Thanks to all the teachers also. So just want to tell you about this. If you are interested, please do come on Monday. We will be posting all the links in our WhatsApp groups and Facebook pages. So if you are interested, you can come to the introduction class. So with that, let us go to the questions now, Dr. Srijit. We have the first question from Dr. Radha, who's asking how much time do we do cupping therapy for?
Actually, when the very first thing to say, I'll be very honest with whatever little I know. And God forbid, if I don't have an answer, I will note down the phone number and email address of the concerned doctor. And I will send an email to Pampa's official answer to the concerned doctor. So you will have the answer, if not now, later. So let us start with that simple understanding. The cupping, actually, the body decides how much it will bring up. So we have had people like going the full this much, if I don't know how much you can see my hand, in the screen, like even up to this much filling, easily it will go more than 50, 60 ml, easily. Even people have only this much. But what is impressive enough, the body, I mean the height of the blood coming out like a cutlet. What is interesting is that the body decides how much has to come out. It will be fairly dependent upon the severity of the condition and also about how much the body thinks should be let out. This applies to Siravedam also.
Okay, we have next question. Kindly elaborate Sneha Agnikarma.
Yeah, Sneha Agnikarma, well, the video would have been the best. It's in the website, but still, the first thing to make sure is that the patient is not diabetic, because that may not be really convenient for the patient to endure. It's indicated not, it's not indicated anyway. That's the first, preparing the patient, and there's a checklist you see in the website, very easy, is that you have a leaf, like cut small piece, like layer, and you're heating the oil, and this oil is what you're pouring bank on the trigger point. So the eliciting the point is the most thing. The procedure is not that hard, but finding the trigger point is the most important thing. And this trigger point is easily felt if you feel, I mean, it's so easy. If you feel the musculature, you find like a, in Hindi, you say gant, like a goli. How do you say that? Normally, undavale, like in Malayalam, like, like you feel like a nodule, like a tight band or tight tuft of the muscle area. So that knot, K-N-O-T, that knot you will easily get, and the patient would invariably scream when you do that. So that is how you have to earmark it with a sketch pen preferably, or at least a marker. Then bank the hot boiling oil is like poured in that when you keep on a leaf surface, because the leaf is containing this hot oil. And that's why arka is better, because it's more thicker and doesn't break off easily. But this arka leaf has to be vati edukua. What do we say that in Hindi and English? Vati edukua. It's how do you, like, you make it softer by putting some heat like this, on the tawa, and then it doesn't break off, that it's a bit softer. That helps you to hit the target. Most important thing, make sure that the patient is taken the consent. Very important, because I've had situations where the patient had a fantastic improvement, then she being allopathic nurse and from USA, and they have the habit of suing people. I understand that. That's in the culture of the society. I understand that. I respect it. Doctor, if you had told me that this will have this kind of a 3rd-degree burn, I would not have volunteered for it. And I said, ma'am, a relief you did not get from USA, you got it here. Well, that's secondary, doctor. So why I'm telling this social point to you very clearly, please make sure that you protect yourself in a technical manner and then do the process.
Okay, we have Dr. Rekha asking, can you elaborate the treatment for Parkinson's, migraine, anorectal? 3 cases.
Yeah, actually, that is not the subject here, but I can definitely say anorectal is not an area of surgery that I am doing. Mine is Ksharak Karma, not Ksharak Sutra. That is one thing. I will try to link the parasurgical side to it. So coming to the migraine, we all have a very clear understanding that migraine starts also from the gut. We will have relevance of hyperacidity. We will have relevance of timely food. We know that sharkara, that is jaggery, sharkara of Malayalam is jaggery, or the good in Hindi, is important ingredient, anupana in Patyashadangam Kashayam, otherwise doesn't make an impact. But when we link to the parasurgical side, and if you know that it's not a muscle tension headache that goes off after a good sleep, when we know it's not a paranasal area heaviness, that's the sinusitis in the morning, Then we come to the point that Madhu Yashyadi Taila, that has been taught to me by Dr. Srija Sugeshan ma'am, she's one of the best Sharakya in India, faculty, is the one I would commonly use up to the dose of up to 5 ml, both nose at a later stage, from 1 ml, 1 ml, 2 until 5. But this is the easily doable thing. The challenge with the parasurgical part of migraine is I have not done a single case wherein the supraclavicular bloodletting has happened, because the volunteers are very, very less. It's very difficult to convince somebody in private practice to have the bloodletting from this area. Very difficult. So I never got a chance. I'm still waiting for it. But I know that a good friend of mine, one Dr. Biju, KV, he is in Kozhikode district, medical officer. He has done 20 cases of the supraclavicular bloodletting as a PG student in migraine. So that is the best I can tell. I have not done, I never got a chance.
Okay. Now we have another question. In this pandemic, how are you using all these therapies? What are the precautions? And that's it.
Actually, in this pandemic, nobody is volunteering for these kind of therapies. In fact, they don't even want to see a doctor as much possible. Even if they want a prescription, they would prefer to have it on the phone like that if there is somebody who is known to us. So the people contact is very, very less, at least in our area. So it's totally out of question. People don't even like to have a shake hand, obviously. And these procedures are definitely not happening.
Okay. We have Dr. Alka asking, Ruksha and Snigdha Agnikarma, can we do both in Sa-Ama and Nirama Avastha?
The interesting thing in these procedures is that I should start from that experience in my government dispensary. The answer is definitely we have to reach the Nirama Avastha, definitely. The reason is simple, that most of the times, unless you get the system cleared by Dashmula Kaditraya or Dashmulam Kashaya or Punarnavadi Kashaya or Gokshra Gulgulu, group of Shopahara or Mutrala, whichever you may call, the effect of Agnikarma is not that strong, because Agnikarma, once done, you can't undo it. It's like you're using radiation therapy in oncology. That is a challenge. And the reason I say is that initially when I was doing, the results were great. And I was also looking for more people to be done. We need more data and more experience. So I was just going over enthusiastically with doing for tennis-elbow other conditions. And we realized many of them get septic or infected. And the reason I later figured out, after discussing with my other friends too, is that those patients who were done that were the ones who were brought by the ones who were getting much better by Agnikarma, because these ones who got better were already in some or the other form of Amahara or Shopahara or Mutrala kind of medications, which made the body ripe, or rather right enough for the procedure of Ruksha Agnikarma. But the ones who came with enthusiasm and my enthusiasm, they did not reach that stage, which takes easily a week or two, even sometimes 3, when all those inflammatory responses come down. So that is why those cases failed terribly, and the first ones failed successfully. This is how I started to communicate in whichever classes I took, that yes, we need to ensure that we get the Shopahara aspect done. Coming to the Sneha Agnikarma, again, the same rule applies. The difference is that when it's a Snayu Sandhi kind of scenario, the Sneha Agnikarma has a deeper effect. And the Ruksha, you can't drill a red hot iron rod beyond a certain point. That's why it's more kind of a, that are like Mamsa maximum, like it's more of a superficial level. The Snigdha is more for a, it's like this. I would say Snigdha is like a missile or rocket, and the Ruksha is more like a bullet. So this is the easy way to decide to what extent it has to be done.
Okay, we have Dr. Rekha now asking a question. Dr. Rekha, hello.
Good evening, sir. It was a wonderful talk.
Thank you, doctor.
Thank you. Sir, do you treat Parkinson's with these procedures?
No, definitely not. They don't come under the purview of this one. No, Parkinson is more of a Vata Vyati. I mean, it has a Kapha component. That's why sometimes even Sadhya Vamana gives a relief in Parkinson's stiffness and rigidity aspect. But when it's more of a shaking variety, or you call it more of a Vatika like situation, no, I mean, sometimes even our medicines don't have any impact, regretfully. And after 11 years, somebody is having Parkinson for more than 11 years. It's like, I don't think there's great we can do.
Okay, we have Dr. Anita asking treatment for cones.
Cons actually is very tough. Of course, we use plasters, but then there is a special cream we call corn fruit cream. It's not Ayurveda per se directly. Some Siddha. It's very effective. But what you need to do is, if it's more superficially level, it is good. Agni Karma has a role, agreed. But then the challenge is, if the person is diabetic, we have a tough task. So there is more of a Ruksha Agni Karma that is more relevant. But the excision is a big challenge. So I would not say great hope with cons, not very easy. And the challenge is, first of all, you're trying to do something that is not very common. That's first challenge. The second thing is that the acceptability is very less. And third, because you're doing something invasive. And thirdly, you can never guarantee 100% for everything. So then they say, you really offended my body. See, I'm telling a lot of social points to you because that's not taught in the academy. At least we did not study. So this you need to be very clear about. So I would say, frankly, don't be over confidently doing it just as I did. But I had the, government sector with my background. So people liked it. So they kind of forgave me for whatever mistakes happened, however, unintentional they were. So this is how it, I would say, be very selective in what you want to treat. Cons is one such to be extra careful about.
Okay. We have Dr. Anand asking, is it Arkapatra Kashaya Dhara or Taila Dhara? Please clarify, or is it extracted Taila on the painful area?
Okay. Snehagni Karma, it has no Kashaya Dhara, not at all. It's just Arkapatra is cut and you boil it in Karpura Tailam, Karaskarpan. It's your choice of oil, doesn't matter. And few pieces that are cut, which have oil already and hot, they are placed in Arkapatra, which is like vati edutadu, kind of made it soft. And that hot is put in this. So basically, the hot oil is touching your body through the made soft, if I use that word, made soft Arkapatra. So that acts as a buffer not to get too much heated or too much burned. And that's how you press the area. It's like 3, 2, 1. And what I normally say to the patient, because they need to be prepared, otherwise what happens, they get a shock. You say, like, when it's 0, I'll press it. So they say 3, 2, 1, bang. They are ready for it. Some patients say, doctor, don't tell me anything. I'm afraid. Just leave me alone. Let me just give it to you. You do it directly. So that's also another approach of doing it. The patient has to be managed. It's a very sensitive process with confidence, and it is possible. There are some patients who prefer, because they yell out, they say, okay, bring a towel, put into my mouth, and I'm just tightly holding it. So this can be such a show, to say so.
Yeah. In my experience, ladies tolerate pain much better than males.
Yeah, actually, I'm a great admirer of ladies, so I will totally agree with you.
Okay, next is, cost of Kudipraveshika.
Actually, Dr. Saab, there are 3 places who do it. One, to start with, Dr. Dr. Sedu Madhav and Dr. I think Kerala, he started in a institutionalized manner. What I am telling, what he told me over the phone. So I don't know what the current rates are. And a year ago, he said it is 30 lakh rupees. That is what he said to me. I don't know, the rates have changed, whichever for 90 days, whichever. And then what we do is, it is 5,000 rupees per day. So it ends up being, you may call it like 1,50,000 if it is for 30 days. We all know that a normal Panchakarma retreat would have 8,000 rupees per day for Panchakarma. And I have the same tariff as my mentor, Dr. Raviraj Kadle sir. He's the second person who started doing in India in an institutionalized manner. He has the same. So we thought, no, it should be more accessible for people. And why I put that, how I can be useful to you, is that we need more people doing Kuti Praveshika Rasayana. I mean, more doctors. So I would really dream if every district has a Kuti, it is fantastic. But before we think of the cost for doing to somebody else, you better do it on yourself for a week. So that would be the best way of thinking of it.
Okay. Dr. Niranjan is asking, which Kshara is used in tonsillitis condition?
Actually, it's Abhamagra Sharga, the one that I got from Dr. Ravi Shankar Parvaji sir, because it's very easy when you get ready-made buying from somebody. In the website, I have easily shown about the aspects of what we call as the starting point of preparation till the finishing point, how it looks like. But there are people, there are doctors who are what we call as ready-made makers. It's very easy. So I think it's always possible to get that list of doctors. And I think even AVP Coimbatore is selling Shara. It's my impression. I don't know fully. Somebody told me. I haven't purchased it. And on top of that, it's only for the tonsillitis that we use Abamara Shara. But when it comes to nasal polyp and hypertrophy, if somebody wants to do the very next day, like today you have the class and tomorrow you want to do it, there's something called Confoot cream. It's available in Palakkad for sure. They courier it. I mean, this much of bottle would hardly cost you about, I think, 40 rupees, and you can easily do for at least 3-4 sessions for at least 5 people. It is so cheap. I mean, material cost. But then it's not a question. Dr. Sham, can I say what I said that I will communicate later? It's not a question, I know, but can I say that?
Sure, sure.
Yeah, okay. Because I remember one patient of mine, outsider from Africa, after doing Sharakarma to her, it was nose, for the next 6 hours, amnesia. She forgot everything. Imagine my shock. They came as a family of 5. And then doctor, after, I don't remember anything. Such a scene, such a drama it happened. So please be writing all disclaimers from the patient. Very important. Otherwise, you'll end up in trouble.
Yeah, there's something called as surgical consent. If
Yeah,
you
yeah.
want to, you can
Yeah.
Google it.
Yeah.
That is, I suggest that also. Again, next question is how you have treated tonsillitis with nasal polyp.
Actually, tonsillitis with nasal polyp or Shara in nasal polyp or with on tonsillitis.
The question is like that. So,
Okay, so let us divide it two. Both are welcome. In tonsillitis, the first thing is we have to make sure, of course, the video is there, but to make it easy here, you have to make sure that the gag reflex is not happening. And for that, you simply spray Xylocaine so that you are just kind of, numb the oral cavity. Because what you're going to do is you're going to apply the Shara for 45 seconds, even up to 1 minute is okay. And the Shara that you take with, this forceps that you put in it's very much there in the video. In a small cotton, you apply the Shara and you are getting, of course, as much open mouth possible. You don't necessarily have to have a tongue depressor, but if the person can open it clearly. We don't want the person to object to our intrusion. This is very important. What we would always prefer, once we numb just by spray of Xylocaine, simple, then you get a very clear permission. Yes, I can keep 1 minute the Shara on the tonsil surface that is visible, that is hypertrophied. This is how we place it. And after that, you have to gargle with Amla Dravya, which is you can have more, that is Kata Chas or Kata Takra. I mean, simple is that Naringa Valam, lemon, Nimbu Pani, gargle it, the Shara countered by Amla, and that's how it is done, the post of that. But it is very important that you keep all these Nimbu Pani, etc. ready before you start anything. So in the website, I've made it sure in such a manner that it is a checklist, 1, 2, 3, 4, all checklist. It's so welcoming feeling for the patient. When I had presented this in SNA Aushadashala, I think it was 2016-17, Dr. Nambi had, Dr. Narayan Nambi, he had his students from Sri Lanka and elsewhere. And they find it very convenient that when you have a checklist, the patient also feels that there's a process involved in it. That's very important. Coming to the nasal polyp or the hypertrophy also, we can do the Sharakarma only if you can see the mass. Otherwise, we can't, I mean, we will end up like Chinaman or a perforated nasal septum if Sharakarma is done a bit too much or you just deviated a bit from the action deserving area. Why I say this to you, like Agnikarma, even Ruksha Agnikarma, camera in one hand and the Shalaka, no problem. Siraveda same, camera one hand, needle, no problem. Sringam also to some extent, you can kind of be overconfident, but not with Sharakarma. You will eternally puncture his nasal septum if you go wrong with camera one hand and the procedure. So that is something I would say. There are occurrences happening mostly with Siraveda and Agnikarma agreed after 3, 6 or 9 months, but Sharakarma is kind of a treatment in its totality. So it is very powerful and it also means you're handling a bomb.
okay, we have Dr. Anand asking a question now. Dr. Anand?
Hello, sir. Good evening. Hello.
Yes,
Yes,
sir.
sir.
Hello. It was wonderful presentation. So thank you for that. Yeah, and my question is, Purva Karma and Pashat Karma of this Sarkapatra, na, you end point I didn't get first question.
Ah.
And after Purva Karma and Pashat Karma of Arkapatra, Snehagni Karma. And Snehagni Karma can be done in what are the conditions? You can just give us a...
Yeah. Sir, Purva Karma typically, there is not much because the consent seeking, etc. is what is more of a Purva Karma, actually. And we generally make a mild Abhyanga and a simple Svedana. Actually, even that is not needed because we are getting a higher dose of Svedana by more than 100 degrees Celsius burning it. So that is how I would take it actually into effect. And that's the Purva Karma part. When it comes to the Paschat Karma, it is anyway we are creating a burn, agreed. We typically apply the aloe vera pulp, the Kumari pulp, or even the Murvanna is fine. But I find personally the aloe vera pulp has a more cooling feel for the patient. So the Murvanna, agreed, it is used for burns. I understand, we respect that. But no, the patient should also feel that cool feeling, as good as ice cube kept there. We are not using ice cube. We're using this that makes it heal very fast. But we generally let the body to a bit cool down and not immediately put the Kumari, but we keep it ready there. And so the patient knows that we're going to apply it. And the other thing is that when this the mucilage surface of the Kumari is getting, or rather losing the coolness, we immediately change it because we have to make sure that the patient always feel that cool feeling. Because one rash and they can't sleep that night, they would blame us. Blame game is very high in parasurgicals, and so is praising you. Both can happen. It's like you're handling a double-edged sword. So it's very important that this aspect is taken care of.
We have another question. Anything you have to suggest for coliform warts?
Warts is a Rukshagni Karma mostly. And the warts, the problem is that, it can always come back. So that's why majority of the time, the dermatologist would deal with it. And that is very, very important.
Okay. We have
Karma Ruksha is no scope for Snehagni Karma. I don't know if I missed that. Snehagni Karma is like very muscular area, very thick area, where it's more of, we have a muscular tendon ligament, that kind of a situation where it's more deep needed. And we have to keep in mind that once we do Agni Karma, we don't have a chance to do it time and again. This is the big challenge with it. So we need to be very, very clear about it. Okay. Dr. Saab, 1 second. One Dr. Krish Ragha, 8:35 p.m. The doctor has mentioned, the practical oriented, where is that? Or the videos, where are they available? But no, I have already answered that in the website, it's there.
Yep.
Because I don't want somebody to feel that I'm leaving it halfway. That's not my intention.
I'm just going through the relevant questions. So that's how yes. So please mention the site of Siraveda and sciatica.
Usually, no, this is, of course, technically we would use the dorsum of the foot. We would use the, the posterior surface of the, medial malleus, agreed. But in reality, you don't get vein that easily. This is a challenge. So what I usually use, and that's the word I use in that technique is that how to do and when to do and where to do. And this is that where to do question actually. What we usually find from these patients is that they say very typically, I'll say in Malayalam because that's easy to say and then I'll get into English. They say, Doctor, vedana verumbondallo. That's a clear indication body is telling that, that the patient says that the vein is getting up when I feel hell of a pain and it just goes off when the pain goes off. Like in Hindi you say chilla. The body is screaming. Can you please get this bloody out from my system? No, the bad blood from the system. This is what it says. So please rely on the patient's narration. Where do you see this happening, that surge? On top of that, any vein nearby to that area of that dorsum is still enough because we need the bad blood to just come out, if not the exact spot. And I found relief even with just 5 to 10 ml, people finding relief with pain. Even with 200 ml, people finding relief. So we just have to release it. And that's what acupuncture people do also. They get only a few drops, we get many milliliters of that.
Okay. Now we have Dr. Venkatesh. Hello, Dr. Venkatesh.
Sir,
hello.
Hello.
Your voice is low, doctor. Hello.
Hello.
Yeah.
Sir, in the hydrocele, what kind of procedure we can do? Is this Happy karma or some any other oral medication will help or
Sir, which condition, sir?
Hydrocele, I think.
I haven't done, and I don't find there's more role with parasurgical as such. The maximum we would convert, like obviously it goes for more of a surgical method than parasurgical. What I have seen from the OPD of the legendary Dr. Rajagopalan sir, he was always using, of course, Ulli Vetiradi, every one of us know that Kashayam, but Triphala Kashayam with Gomutra. That is what he was using regularly to find a fantastic relief. But then we need to be competitively smart, because the patient should not say that such an important organ, you kept on doing all the herbal methods, I would have been well off with a surgeon. That blame game we don't want. So that's why I would technically say like well left.
Okay. So we'll be having only one more question. I'm very sorry. We don't have that much time. We'll go with Dr. Rita. Hello? Hello, Dr. Rita?
Yes, sir.
Please.
Yeah, thank you, sir, for a nice lecture. What happened to that patient? I got curious, so I asked. This African patient, you said, after a nasal kshara.
Thanks to the ancestors of Ayurveda and my good stars those days, after 6 hours, she became normal. I was more relieved than her relatives, I would say.
Of course. Okay, so that was the last of.
Things, doctor, is simply because no, it's not a question asked to me. I haven't seen, but my mentor, Dr. Padmanabhan sir in Wayanad, he has told me that he has situations where instead of the blood, the lymph came out. So you have to tell the patient very clearly that, you see, buddy, I'm doing my best, but maybe blood doesn't come out. The last thing, at least from my side, I've had embarrassing situations where the needle is correctly done, the vein is correct, the blood we can see, but because there is a manufacturing the factory defect in the needle was obliterated, the blood never came out. And imagine the embarrassment, whatever. So these things can be a bit embarrassing, just to let you know. So when you do Sira Veda, you say very upfrontly, I have no guarantee blood will come out. Simple as that. Lot of disclaimers.
Okay, so that was the last of the questions we'll be taking today. Rest of you, if you want to get connected to Dr. Srijit, do let me know, and I'll give you his number, and you can contact him. Of course, he has already told you the website. It is agnivesh.info. Sorry. So if you want to go to that website and see, you can. You can do that also. So before we stop, let me call upon our president to do the honors, sir.
Hello.
Yes, sir.
May I audible? Okay.
Yes, sir. Yes,
Thank you.
sir.
Dr. Srijit, it was a wonderful presentation. All the participants, including me, are very much eager to do all these things. So there comes the answer of Pamba Mastery. We are conducting a course, Pamba Mastery, for teaching everybody all these parasurgical techniques. First of all, in this 16th onwards, we are teaching them how to diagnose this fracture, how to treat marma, or like that things with a nominal price. All participants can join. And also in the next session, we are planning your subject, the parasurgical techniques. And we are very much thank you for giving an introduction to that parasurgical technique training. It is a very wonderful session. We are grateful for your commitment to Ayurveda. We hope you accept this is a small token of our appreciation. We wish you all the very best in life and practice. Thank you, Dr. Srijit. Thank you.
Thank you, sir. Thank you. So, Dr. Srijit, thank you. Thank you for sharing your knowledge and spending some time with us. Wonderful, to know that you are a fellow practitioner of these arts, let me say. So, thank you for that. And we'll be closing now. Thank you. Thank you. So, what next? Tomorrow, we have a neurosurgeon with us talking to us on head injury assessment and warning signs. This is a area where we have to take care, and Dr. Anudat is a fellow Rotarian and a very good friend of mine. He'll be joining tomorrow to give us an idea about these subjects. I have to thank my team, Dr. Shabana Balsham, Dr. Rahul J, Dr. Veena P. Raghunathan, Dr. Anisa Ashraf, Dr. Ansha Shaji, Dr. Rajashree Tia, Dr. Pooja and Dr. Fatimat KK. These are the guys who help us run this program. Thank you all for participating. If you have any suggestions or questions, please contact me in the number below. Please let your friends and colleagues know about this class so that everyone can benefit. My number is 960-550-9999. If you want to get connected to Dr. Srijit, do let me know in this number. Our website where all the previous videos are available is www.pambaayur.org. Just a thought for tomorrow morning when you wake up. Always look on the bright side of life. So with that, let us all grow together. See you all tomorrow. Thank you and good night. Thank you all. Thank you, Dr. Sundar.